Good Wednesday afternoon. I'm Dr. Martha Buchanan, Director and Health Officer here at the Knox County Health Department. Our moment of gratitude today is dedicated to our partner organizations and community leaders who are involved in upcoming testing opportunities in East Knoxville and Knox County. We looked at our data and chose these areas of the county because there has not been much access to testing in those areas. We are grateful not only for our teams, but also for those in our community who've worked to coordinate these testing events. Now, a couple more notes about testing. Today, we continue to offer walk-in testing at the main health department located at 140 Dameron Avenue from 9 a.m. to 3 p.m. Tomorrow, we'll be offering walk-up testing opportunity at the Carter Senior Center from 10 a.m. to 2 p.m. And on Monday, we have another testing event in East Knoxville. This one will take place at the East Knoxville Free Medical Clinic at Magnolia Avenue Methodist Church from 10 a.m. to 2 p.m. For all of these testing opportunities, you do not need an appointment or to have symptoms, and testing is at no cost to the individual. Before we move into the local situation, I want to provide a quick update on the state-provided cloth face coverings that we've been distributing. Due to an overwhelming response from organizations requesting these masks, we are temporarily suspending the request form on the website until we are able to get more in stock from the state. We really apologize for this inconvenience for those who are seeking masks. We will still be distributing masks to individuals here at our main health department location, but we simply don't have the quantity at the moment to distribute them in bulk to organizations. We are working to get more soon, and we'll resume distribution to organizations at that point. And we're grateful for the people that want to provide masks for those who might not otherwise get them. Moving on to our local situation. We have 596 confirmed cases of COVID-19 in Knox County. Additionally, we have 21 probable cases. 487 of our cases have recovered, bringing us to 104 active cases. 57 individuals have been hospitalized at some point in their illness. Currently, we have 6 Knox County residents hospitalized for COVID. We are thankful once again to be able to report no additional deaths due to COVID-19 complications. As we have mentioned, the county's Board of Health will meet virtually this evening at 5 p.m. to review and consider how Knox County reopens. That meeting can be viewed on community television or streamed online at ctvknox.org. We encourage you to watch it tonight, and we'll be happy to answer further media questions tomorrow that are submitted through the Joint Information Center. And now I will open it up for questions.
All right, go ahead and put your questions in, please. From Brian Hornback, Monday evening, the Knox County Commission in the work session were not utilizing social distancing or face masks. Does this negate the continued messaging to the community to practice the 5 core principles?
Certainly not. The 5 core principles are still valid and important. Commission arranged their meeting in the way that they arranged it. And so it doesn't invalidate the 5 core principles at all.
From Shannon with WBIR, is wearing a mask but touching other things and never washing it riskier or the same as not wearing a mask at all?
It's a great question. I'm not sure we have the science back on that, but what we do know is that touching your mask regularly can potentially contaminate your hands with respiratory droplets, but you really contaminate your hands with your own respiratory droplets, not somebody else's. So touching that and then touching other things could potentially spread virus to someone else. You do need to wash your mask regularly, and those who are wearing them every day, all day, need to wash them daily because they do collect that moisture that comes out from your mouth. So we know that wearing a mask is better than not wearing a mask. Avoiding touching it is a good idea, but it's hard to do because they slide up and down. I know I have that problem with mine. So be thoughtful about that and maybe wash your hands or use hand sanitizers afterwards. But it's also really important to remember that all of us need to be washing our hands regularly and cleaning surfaces regularly to reduce risk to everyone.
A couple more questions here from Shannon from WIR regarding masks. Her next question is, are there any risks associated with wearing a mask for a long time, like difficulty breathing or increased body temperature?
I haven't seen any evidence about increased body temperature. people that work in hospitals have been wearing masks during their shifts for a very long time, but well before COVID-19, and we haven't seen that happen. As far as shortness of breath, what I would say to anyone who feels short of breath, remove yourself from the situation if you can and take a break. Take your mask off and allow for that breathing. There is enough oxygen exchange for people to be fine with that. Again, hospital personnel have been doing this for years. I have seen pictures of people who wear masks daily who get some irritation on their face from either the material the mask is made of or just the moisture. So again, that's something where, if possible, you can take a break from using the mask if you need to, or consult your physician. Or if you do have to take a break from using your mask, make sure you social distance. So lots of different things to just use some common sense.
Her next question is, a viewer said she's not wearing a mask because she's had 2 friends get strep and doctors told them both it was caused by wearing the masks. Is that possible, and how?
Wow, that's a great question. And as I stand up here thinking about the science behind that, I'm not sure what science would support that theory. And so I don't believe there's a risk of getting strep from wearing a mask. But again, I haven't looked at the science.
Another mask question. Shannon asks, what would you say to people who say masks don't work?
I think there's a body of evidence that would disagree with those people, that we do know that masks do trap the droplets that you're breathing out. And we're not talking about the big droplets you can see when you accidentally sneeze and don't cover your mouth, it traps those too, but we put out little droplets that we can't see every time we breathe out and when we cough, when we talk as well. So if you've worn a mask, you know that moisture collects on the inside. Those droplets adhere, those little tiny droplets adhere to each other and become big droplets you can see after that. So it's not the big droplets so much that we're worried about. It's those little droplets that you can't see that we're more worried about. And we know the mask trap those.
And a follow-up question to that one from Shannon. She asks, for people who don't wear masks, do you have any recommendations for them to stay safe?
Sure. If you choose not to wear a mask, please observe social distancing and wash your hands regularly and touch surfaces regularly. And no matter whether you're wearing a mask or not, stay home if you're sick. Those things all need to be done by everyone. It's options. You can wear a mask or not wear a mask, but we need to reduce risk for everybody. So if you're not going to wear a mask, observe social distancing. If you're going to wear a mask, we still want you to observe social distancing, but it's not as important. So people are empowered to make that choice and do what's best for them.
From Jeff with WATE, do you have a prospective phase 3 reopening plan that you plan to present at the Board of Health tonight? And if so, can you share that draft?
I don't. What we have is the one that has been put out there that outlines some big picture things that is in phase 1 and phase 2. But that's just an outline that has been there for a while. The Board of Health will be making those decisions, and we'll be talking about that after they make those decisions.
From Vincent with the Sentinel, how many mask requests did you receive from organizations, or roughly how many masks did organizations request from you? Great
question. That's a level of detail I honestly don't just have off the top of my head. I do know that we had hundreds of organizations ask for masks. And that we got to date, we distributed 171,943 masks, some to organizations, some to individuals. So the organizations were asking for bulk numbers of masks, and I don't have the numbers of each of those organizations in my head.
Yes, we've received, like Dr. Buchanan mentioned, I don't have the firm number, but it's more than 300 requests from organizations. And Vincent also asks, which organizations did you distribute the masks to?
Again, great question. I don't have that information.
From WVLT, they ask, is adult business like strip clubs that are also bars allowed to be open in Knox County?
You know what? I'd have to go look at the guidance. I don't have the guidance totally memorized in my head.
Also from Vincent with the Sentinel, I think this follow-up to his previous questions. Are you prioritizing certain kinds of organizations over others with respect to mask distribution, or was it first come, first serve, or more targeted?
You know what? I'm not in charge of mask distribution. We have another group of people managing that. We can certainly get that information on how they made those decisions to you later.
Any other questions, please go ahead and submit them. From Claire with WUOT, at the end of May, you and others from the health department discussed targeted efforts to Knoxville's Hispanic and Latino community. Based on the data since that time, have these efforts been effective?
Well, I think it's going to take a much longer than a couple of weeks to be able to see if our efforts were effective. It's going to take time for some of those cases to recover and other things to happen. We continue to do that outreach. We continue to have those things out there in social media. We continue to get feedback from our partners who work with our Latino community, and we'll continue to change that as needed to reach out to that at-risk population.
Another question from Claire is, do you plan to discuss the disproportional distribution of disease at tonight's meeting?
We will discuss data at tonight's meeting. I'm not sure we'll get into the disproportionate distribution of disease at tonight's meeting. Tonight's meeting really is more about how does the community reopen, or does the community, what do we do next, and where we go from here.
Any other questions, please go ahead and submit them into the chat feature at this point. From Jeff of WATE, will a specific reopening plan come out tonight?
I'm not sure. We'll have to wait and see.
Any other questions? Please go ahead and submit them now. From WVLT, can an email be sent later if strip clubs can be open?
I consult the guidance. That's all I can say. Please consult the guidance. Or call 311 with that question. That's another great idea. That's who's answering those questions for us.
Not seeing any more questions. If there are any more questions, please go ahead and submit them. All right, not seeing any more come in. So thank you all for joining us, and we will be back during the media briefing on Friday at 12:30. We hope you have a great rest